we're very excited. At this year's ASH meeting, we're reporting the outcome data of our multi-center phase 2 study evaluating the combination of oral azacitidine plus CHOP as initial treatment for patients with newly diagnosed peripheral T-cell lymphoma. I want to start by providing some background, which might be helpful. Peripheral T-cell lymphoma, they're generally quite uncommon, heterogeneous, and therefore very difficult to study in a large scale. I think these factors pose challenges for clinical management, in terms of precision diagnosis and personalized treatment to optimize outcome. As you know, the most common initial treatment is CHOP-based chemotherapy, which doesn't work very well for most PTCL because of suboptimal CR rate and also poor long-term survival outcome. We now also know that those genetic mutations that controls epigenetic regulations are important for peripheral T-cell lymphoma pathogenesis. For example, recurrent mutations including TET2, IDH2, DNMT3A, ROAs, those are frequently encountered in a subtype with T follicular helper phenotype, which includes angioimmunoblastic T-cell lymphoma. It was previously shown that this subtype has treatment sensitivity to azacitidine, which is a DNA methyltransferase inhibitor that modulates epigenetics. Based on those considerations, we have conducted the first study combining azacitidine as epigenetic priming with CHOP chemotherapy for untreated PTCL. So regarding the study design, in this study, a patient received standard dose CHOP every 3 weeks for a total of 6 cycles. What's special about this combination is that they also received this oral azacitidine at 300 milligram daily as priming for 7 days prior to cycle 1, day 1 of CHOP, and then for 14 days prior to day 1 of subsequent CHOP chemotherapy. The primary objective of the study is complete response rate at the end of 6 cycles of treatment. Secondary endpoints including safety, survival, as well as exploratory biomarker studies. Regarding the study result, we have now completed the accrual and we treated 20 evaluable subjects. The majority of the patients having the PTCL TFH subtype, which includes angioimmunoblastic T-cell lymphoma. We also enrolled patients with PTCL NOS and ATLL. The treatment was very well tolerated with expected side effects to chemo, CHOP, and azacitidine. They were provided in the outpatient setting. The side effects included myelosuppression and gastrointestinal side effects that can easily be managed. The treatment also appears to be highly effective. The CR rate was 75% for all patients, and for those with PTCL TFH subtype, the CR rate was 88%, which was quite remarkable. Just as a reminder that historically the CR rate with CHOP was about 40 to 50% at most for this subtype of PTCL. We also want to report that about half of those subjects treated on the study successfully completed consolidative stem cell transplant as well. In addition, at this year's ASH, we are also reporting the biomarker analysis. We did next generation sequencing of the diagnostic tumor samples of those that's available from patient. We confirmed the prevalence of the recurrent genetic mutations expected for the TFH subtype. Some of those mutations, including TET2 and DNMT3A, they may impact on response rates and survival. Furthermore, we also performed integrated gene expression and methylation analysis to study the genetic pathways in response to the azacitidine priming. These data would help us and other investigators to optimize design of future studies with epigenetic agents and combination. So we're very excited about our study results. which looks to be a promising initial treatment strategy, particularly for peripheral T-cell lymphoma subtype of T follicular helper phenotype, which has genetic susceptibility for epigenetic intervention. Finally, I want to mention that this active combination regimen is currently being evaluated in an ongoing randomized Alliance US intergroup trial A051902. So we look forward to learn more in this large study.